Oh, hi. Welcome to Aquatazoo, where we like to nerd out over all things zoo and aquarium related. I'm l.semple, and today I'd like to talk to you a little bit about medications. I know this one might be weird. I realized recently, as I was cleaning out our medication cabinet where I work at an aquarium, that I've never really talked specifically about medications and how we keep them and manage them and how it all works. So I will say that I definitely have more experience with aquarium things than zoo stuff, but it all kind of works similarly. Okay, do we keep medications on site? Yes, we do. Short answer, yes, we do. And it depends on the type of animals that you have, the more common issues that they might experience as to what you might have on hand as a zoo or aquarium. And it also depends on your veterinary staff. I don't necessarily have veterinary staff on site all the time where I am, but with their oversight and their okay and their ability to obtain medications or write prescriptions for us, we do have various different types of medications available at any given time. So you would be surprised what types of medications work with the different kinds of animals that we work with on a daily basis. And by we, I mean those of us working in zoos and aquariums and animal care specifically, because a lot of it tends to be your common pet medications, the same things that work on dogs or perhaps work on hoofstock in agricultural settings. Those are the types of things that we have on hand. We also have a lot of medicines that work for people, oddly enough. And so that is interesting for people to see if we ever open up our medicine cabinets, I guess, and let people peer in there. They might recognize some of the things that we've got. So what are kinds of things that we might see here? You might see some Baytril. That's a pretty common antibiotic, a general antibiotic that you would see or have prescribed to, like, say, your pet dog. That is one that works on many different types of animals, and it's one that we use very commonly for any kind of bacterial infection that an animal might have. That includes fish, oddly enough. Now, it gets a little weird because if you're getting the oral type, that, the kind that an animal is supposed to ingest and swallow, they're still beef flavored because they're made for dogs. Fish don't like that. I will just say that. But you can use those types of things for fish. You can use them for other types of animals, not just dogs. This is all, of course, under the guidance of a veterinarian. We don't prescribe and administer drugs without the okay of a veterinarian in AZA accredited institutions, just so you know. Other types of medications you might see would be a lot of eye drops, eye ointments. The same kinds of things that would work for humans in that case often work for animals too. The structure of eyes tends to be very similar. There's some differences, of course, but when you're dealing with eye injuries or scratches or anything like that, there's a lot of eye ointments that work for people that also work for animals. And you'd be surprised how many times animals scratch their eye or get something in their eye or just need some attention, need some ointment to try and keep out any kind of nasty bacteria or anything like that. So we do have a fair amount of eye type medications that we keep on hand just in case we ever have an animal that's really experiencing some eye pain or eye issues, so that we don't risk them losing their vision for any reason. Like, eye problems can get out of hand quickly, and so we try to address those as quickly and easily as we can, especially as animals get older. If they tend to develop cataracts or astigmatism, like they can develop all the same eye problems that people have. And so helping them remain comfortable, especially as they get older, is part of the plan when we're keeping animals in human care, right? So there are a lot of animals that tend to get cataracts as they get older and tend to have similar issues with their eyes that people do. So we try to keep medications on hand that are ready for that kind of thing. And we'll also incorporate a lot of training with a lot of animals that experience this kind of difficulty so that in the end, when they need the eye drops, if that ever becomes a thing, or if it's a species that commonly needs that kind of thing, then we have the ability to administer eye drops without scaring the animal, without having to wrestle them. They just are trained to be okay and tolerate it. I'm sure they don't love it, because I'm sure that it's very weird to them when we're putting eye drops and ointments in their eyes. But I'm sure, especially if it's painful and when we're administering some sort of like numbing eye drop or, something that reduces pain, I'm sure that is worth it to animals. So we do train a lot of animals to be okay with that sort of thing. You'll most likely see some saline and or sterile water. This is what we use to dilute injectable medications if needed. When we're dealing with very small animals, sometimes we have to dilute a medication because it comes in such a concentrated form and we're dealing with such a small animal that sometimes we have to dilute it. We use sterile water and saline to do that. So you'll likely see some random bottles of sterile water or saline that you can get just from the drugstore or from the grocery store. It's pretty common, and you'll often see it in the medicine cabinets or cupboards of a vet lab or, wherever we're storing the medications. And that makes it so that we can safely administer injectable medications without overwhelming an animal or without causing undue problems. So you just got to imagine, like in my case, you're dealing with a tiny little fish that needs an injection. You can't give them a ton of fluid, but you also have to have enough so that it can come out of the needle when you're doing an injection, if that makes sense. So like when you administer an injectable medication with a syringe or something like that, there's just a little bit that ends up either inside the syringe itself or inside the needle that you attach to the syringe, or comes attached to the syringe. Depends on your syringe. Anyway, there's a little tiny bit of medication that still stays in there, just a teeny tiny bit. But when you're dealing with a teeny tiny animal and they're supposed to get like 0.01 milliliter of a medication, that tiny little bit is suddenly the entire bit that's supposed to go into the animal, but now it's stuck in the needle. So what we do is dilute it a little bit with saline or sterile water so that the volume's a little bit more significant. It's still the same amount of medication, but the volume of the liquid that's going in is a little bit higher, so that when we push the plunger and the medication goes into the animal, like just under their skin or whatever, then there's a little bit left in there, but it's not all medication, right? It's going to be mostly water with just a teeny bit of medication. So we do keep sterile water and saline on hand for dilution. Other common human type medications that you might see are antifungals, which is interesting. An animal could succumb to fungus and fungal infections for various different reasons. Depends on the animal. In my case, I work in an aquarium. A lot of times the freshwater fish, as they get older, can be a little bit more susceptible to fungal infections, right? We don't see it that often because we just keep just a little bit of salt in their water just to fight that off. So it's not usually a problem, but every once in a while, you never know, you may see a fungal infection arise. It's pretty common in reptiles, I would say, as well. And so we keep various different types of antifungal medication. Some examples that you might find might be something like itraconazole, fluconazole, something like that. I know you might not care about the actual medications that are involved, but just understand the types of medications that we're dealing with. So these were drugs that, like many drugs that we use, are usable with humans. They were developed for humans, and they happen to work for animals as well, right? It still, gets rid of the fungus and the fungal infection without injuring the animal, right? There are some side effects, of course. Like, it's not always super comfortable to go through treatment, just like it isn't with any human drugs we might be taking. It's not always fun for animals either, but in the end, we're getting rid of the problem. We'll treat the rest later. the issues that they might still be dealing with. If they're in pain, if they have a secondary infection, we'll deal with all that, right? But we're trying to find the root of the problem and get rid of that. In some cases, it might be a fungal infection. So we usually have antifungal drugs on hand. We may not always, just because a lot of the time those drugs tend to expire quickly and are no longer really usable. So we may keep them on hand, we may not, but they're often found in the medical repertoire in a zoo or aquarium. Going back to the antibiotics, Baytril is probably the most common one that you'll see in all zoos and aquariums. It's a very common, very basic, I guess, kind of antibiotic that we will use for various different reasons. If we're thinking we got a bacterial infection on our hands, but we haven't figured out what it is exactly, we'll most likely start an animal on something like Baytril, like what we call a broad spectrum antibiotic, something that is relatively effective on lots of different types of bacteria. In the meantime, while that's working, we'll have our vets go through and do some testing and try to identify specifically what we're fighting, and then come in the more specific antibiotics. This works just like it does with people, right? So, you can't just fight every bacterial infection with every antibiotic, right? There are some bacterial loads that are more sensitive to certain medications, and we have to do the same thing for animals. So even when we don't know what's going on, we'll start administering something so that we can try and lessen the load on the animal and try to fight back some of this issue. A lot of times you might have some sort of infection going on that then is giving way to a secondary infection of some other type. So, like I said, there might be a fungal infection going on, and there might be a secondary infection of a bacteria going on. And in the case, like, we don't know that the fungal infection's happening, we're probably going to go ahead and prescribe a broad spectrum antibiotic, sort of like Baytril, and we'll just start that going while we figure out what's actually happening, so that at least something's being fought here, right? We're lessening the load on the system of this animal that we're dealing with. Their immune system is at this point compromised because they're fighting off more than one thing at a time. So that's when we start administering something a little bit gentler, a little bit more broad spectrum, something that is not going to make them any more uncomfortable. Some of these more specific medications, antifungals, antibiotics, anti-worm type medicines, the more specific they get, a lot of times the more intense the side effects are. So they might not want to eat, they might get lethargic, they might just not feel well, may induce vomiting, that kind of thing. There's a lot that happens, just like with people. Like, we have side effects for all kinds of stuff too. Any kind of pill we take, we know that there's going to be some side effect at some point. We may handle it well, but the next person who takes that same medication may not. So we're still watching for all of these things as well. Not only are we dealing with an issue that the animal is having, some kind of infection or problem or parasite, what have you, we also have to monitor how they're reacting to their medication. It's all part of animal care and dealing with an animal that's a little unwell. I mentioned it briefly, but we have a lot of dewormers. These are the ones that are probably going to be similar to what you might see in a cat or dog, or in some cases hoofstock. There are certain parasites, little wormy things, that are pretty common in various different types of animals. I would say in zoos this is probably really a common thing, because some of these animals are very similar to hoofstock, or similar that you would see in agriculture, and very similar to dogs and cats at your house, right? There's some similarities there, so you kind of treat it the same way, right? And it actually happens with fish too. There are some worm type critters that we use medications for to get rid of all of those infections. And, they're not always going to overwhelm an animal, but we don't want to introduce that possibility. So when you're dealing with aquariums, the difference between aquariums and like a natural body of water is that the aquariums have obviously a very much smaller volume of water, right? So these parasites would occur naturally in the natural environment, right? But what happens in an aquarium, you have this defined body of water and then it's recycling through the filtration and everything, but it's basically recycling on itself, right? So once you have a parasite that starts kind of taking over, it rapidly intensifies because that same water is recycling and recycling and recycling. It's just kind of compounding the load of the parasite. So if we're not really watching what's going on, it's very easy for a parasite to overwhelm a group of fish because they just get so crazy and in such high numbers. And then there's no other counter parasites or other animals and critters that you would find in the natural body of water to, I guess, deal with that, right? You might have some other critter worm thing that might come along and eat that bacteria, for example, right? And so without all of that happening, the parasite load on the fish just keeps getting worse and worse and worse. So we have to be pretty careful about that, and we have to start treating as soon as we see any issues because we don't want it to overwhelm the animal. And it depends on what the creature is that we're dealing with, both the animal and the parasite, as to how we're going to deal with it via medication. We may also have some really interesting new technology, if you will. I've worked in facilities that used like skin graft type medications and materials to help heal wounds on animals. You know, animals, especially during breeding time, they're beating each other up a little bit, right? They don't have hands like we do. And so oftentimes they're biting each other, you know, as just part of a breeding display or, you know, just behavior. They're chasing each other around. They run into stuff. Like animals, particularly during breeding season, tend to injure themselves and each other. And so a lot of times we're dealing with some wounds that we have to fix and help heal, right? And in some cases, it's really difficult for animals to, or, well, for us to keep those wounds clean because, you know, animals rolling around and stuff, they're doing animal things, right? And so it's hard for them to, A, keep a bandage on it, B, keep it clean, right? They're not thinking about that. They're just thinking about doing their animal stuff like they normally would, which is great. I'm glad, you know, they're not uncomfortable enough to worry about their wound or something. But we will often use interesting techniques to try and stimulate wound closure. And you'll find a lot of that stuff in the medicine cabinet. But that might include honey patches. That's one of my favorite ones because it's kind of a natural thing, but it's also really effective. So if you've got, I've used this a lot on reptiles, but if you've got an animal that's got a pretty decent wound that doesn't seem to be healing on its own, you can get medical grade honey, and that will keep the bacteria out and it will draw out moisture and keep that wound clean, which is interesting. And it kind of stimulates healing. Honey is amazing. I don't know if you've ever really looked into it, but honey is an amazing product. I don't know how the bees do it. It's amazing. But honey patches are one, and you can get them so that they're kind of adhesive, so they stick to the wound or stick to the skin and don't move, so that they just really cover that wound entirely. We'll also use like silver sulfidine, which is like an ointment that we use for burn patients. It just keeps the wounds clean and healthy as they're trying to heal. We'll use Tegaderm, which is kind of a flexible bandage, kind of a sticky bandage covering, I would say. Like you put the bandage down and then you put this stuff over it, and that kind of helps keep it clean, helps keep it a little bit waterproof, and helps an animal heal and keep things clean and covered without impeding their movement too much. We use all this kind of stuff. There's also some really interesting technology, medical technology that's being used that was designed for people and healing wounds and regrowing skin that we also can use for animals. There's different compounds that you can put on a wound that kind of, I guess it almost creates like a matrix for skin cells to grow on and over, so that it just stimulates and makes it easier for those skin cells to grow and cover an injured area. It's really interesting. And so there's all kinds of medical technology that's in use. Veterinarians are really looking for all kinds of solutions to various different problems. They're very creative that way. And so if they find a really interesting human-based medication or treatment that works, they very well might try it with an animal just to see if they can get a similar type of result, or, if it can be of use in their practice, because you never know what's going to work. It could be great. It could be not helpful at all, but we're always looking at the science and the experimentation of it. If it seems like it would make sense for the animal, we'll probably give it a try if we can get our hands on whatever medication that is and give it a shot. It's always interesting to see how treatments from humans or treatments from certain types of animals can work on other types of animals. So, it's a win-win for everybody. We learn something new every day. So we've got a lot of internal medicines that might be oral. We might have a lot of internal medicines that might be injections. We have external medicines that are more of a topical kind of treatment. We also typically have some sort of anesthesia medicine. With fish, it tends to be rather simple. I think it would be much more complicated for your average mammal. But we do keep medicines on hand that will help with anesthesia. If we have an animal that goes through a traumatic event for whatever reason, an exhibit mate gets on them and we have a problem, if they get caught on something within the exhibit, if, they're just having a heart attack or something, anything could happen with animals just like anything can happen with people. And so if we need to anesthetize an animal, we want to be ready to do that as needed. Again, this stuff is happening under the advisement and the control of a veterinarian because they are trained to work with this stuff. But I've been there for various different types of procedures, and there's various different medications involved depending on the animals that you're talking about. But sometimes you need to knock an animal out for something. So I've seen, a toy get stuck in teeth, a limb get stuck somewhere. I have seen animals that just need something removed. Guests drop stuff into exhibits sometimes. And if an animal gets a hold of something that they shouldn't have, there's a possibility they get injured. And so we have to maybe anesthetize them to remove the animal or remove the item from their gut, or, take it out of their mouth or whatever. Stuff happens and we need to be ready for that. We're hoping that we have taken all the precautions to make sure that animals are safe and everything's good, but we need to be ready. If we need to anesthetize an animal and we don't have the medications to do that, we are in trouble and that animal might, pay the price. Related to that, we also keep the medications for euthanasia, for humane euthanasia. So again, with fish, it's pretty simple. We have the medications on hand all the time because you never know if an animal suddenly starts to suffer for whatever reason. You want to help them out. You obviously talk to your veterinarian and, all the people, the stakeholders involved. We don't just, euthanize animals all willy-nilly, but we talk to the people that are involved and we try to come up with the best solution together. Is there any other way we can help them? Is the only way that we can help them to euthanize? Then we will do that. So it's definitely not a first choice, but it is an option. And if we need to euthanize, we want to have those medications on hand so we can do it as quickly as possible. We want to end suffering as quickly as possible. There's no reason to draw it out. So as much as that is not fun to talk about, it is one of the things that we have to do, and we are always ready for that if needed. On that note, there are lots of different medications that are applicable to different types of animals. For fish, it's generally just this powder that we use, that we dissolve in water, and the fish goes to sleep until it goes too deeply into sleep, basically. It's the same medicine that we use for anesthesia, that we use for euthanasia. We just kind of overdose for euthanasia. For your average mammal, it is much more complicated than that, and that will only be done by a veterinarian. And that brings up the topic of controlled drugs, right? Controlled medications. So there's a few different types of medications that are under controlled. And what I mean by that, they're under lock and key, and only certain people have access to them because they are dangerous, or they can be used for various different purposes that are not what they're there for at the zoo or aquarium, if you know what I mean. So there are a few controlled drugs that we will have on hand at our facilities, but they are, like I said, controlled. Only certain people have access to them. They are generally locked up. Well, they are always locked up. And only certain people have the key. And when you use those drugs, there's a log about how much, what it was for, the date, all of that information, so that every bit of that drug is accounted for. None of it goes missing. And we know exactly where it's being used and why it's being used. And so we have to keep very close tabs on that. And by we, I mean veterinarians. They cannot let those types of drugs wander off or be misused, right? Because that's dangerous for people. So yes, those types of drugs are on site. They are under lock and key. They may not even be contained with the rest of the drugs sometimes. I've seen them put under more security because they're dangerous. So again, most of us lock up our medications. It's just good practice. You don't want somebody to misinterpret what's in that bottle for something else. You don't want anybody to accidentally do something with it. Like in our case, we are putting vitamins in food a lot of the time. You never know if somebody might mistake an actual medication with a vitamin and put it in the food, and then we don't realize it, right? So you have to be very purposeful when you're at a zoo or aquarium. If you're trying to get at the drugs, get at the medications, and administer them. It has to be locked up. We keep it secure. We try to make sure that nobody has access to it that does not know how to use those medications. So it's all very controlled, right? But if you happen to have the key to the medicine cabinet, there's a whole bunch of stuff in there. Stuff we have to have, stuff we want to have just in case. It's a lot easier to get treatment going if you can, talk to your vet if they're not, in the office today, or they're not able to look at that animal right then because they're in a procedure somewhere else. It's lovely to be able to start a treatment under the advisement of your veterinarian if they're comfortable with you administering that medication and or, dealing with that initial treatment until they can get there. Then you can go ahead and start getting things ready. A lot of times for injections, sometimes we'll just start getting things ready. It's actually the veterinarian that administers everything, but we're starting to do calculations, we're starting to prepare syringes or pills or whatever it is, and getting all of that ready to go so that we're maximizing our veterinarian's time. They don't have to worry about the little minutia stuff. They can just get in there, get the medication that they need, and administer it, right? So that's what's going on with medications. I know we've talked about veterinary care. I know we've talked about a lot of different types of things involving animal care, but I hadn't talked about medications. And one thing I should remind everybody is that we are also keeping track of when those medications expire so we can get rid of them, because we want to make sure that we have the most up-to-date and current medications available to us. And we work with our veterinarians to make sure that everything's in date and that things are disposed of properly, and that if we need anything, we get it refilled before we actually need it. If we're running low on something that we use on a regular basis, we want to make sure that we have it and that it's in date and ready to use so that we're not scrambling at the last second, because it's nothing worse than having to make a quick run to a drug store or, pharmacy trying to get the things that we need, especially when it comes to animals, because a regular pharmacy may not have access to every single drug that we use or every single medication, but they can get it if we are willing to wait for them to order that specifically. It's not like a human thing that they normally deal with, but they might be able to get it if we give them a heads up. So if we're running low, we try to make sure that we have everything that we need and that it's all in date. And then everything that's not gets disposed of properly. It's all locked up, it's all secure, but it's all kind of interesting because there's a lot that overlaps with human care and agriculture and pets and stuff, and you'll find all of it at your local zoo and aquarium. It's wild. Okay, if you have any questions about that or anything else zoo or aquarium related, or leadership and management things, you can write it up in an email and send it to me at aquatazoo@gmail.com. If you're enjoying the show, and I hope that you do, don't forget you can follow or subscribe on your podcast player of choice. That way you'll get all of that sweet, sweet content as soon as it releases. If you'd like to support the podcast directly, you can find me at patreon.com/aquatazoo. And if you're looking to take a vacation and you don't know where to start, you can let me know. I'm a personal vacation advisor with Magical Vacation Planner, and I would love to help you out. It does not cost you anything extra. The links are in the show notes. Okay, thanks for listening. I heart your faces. Okay, bye.